Hi everyone, my name is Brenda and I'm the Director of Sales and Education for AOMed. I wanted to talk to you about the difference between our older model on the MTS. This is under Skin Culture on the website. This is the one that plugs in, and the new one, the upgraded one, okay? This one is chargeable. This one you're gonna do when it's plugged in, okay? And as you can see, this is thinner, this is a lot meatier, so there's a lot of difference in the weight itself. I like how the new one feels. Not to say that there's anything wrong with this, but this is an upgraded version, okay? I started to do a video a while ago and then I thought it was recording and I guess it didn't save, so we're gonna kind of start where we're at. I'm a little bit red on both sides because I've done the one that is corded on this side and then the one that's not corded on this side. So I've already numbed myself. I put some numbing cream on myself. Of course, if I'm numbing, I've taken alcohol and wiped it off. So we're just gonna go ahead and do a couple more passes. I want you to kind of hear the sound. I want to kind of give you some tips. So one thing that I have done is, as you know, because I talk about this all the time, I have issues with the fat loss in my face, and I'm still trying to get that back from being sick in January. And so I'm going to be doing the cell booster from Dr. Estee that has the 20% human adipose in it. It also has PDR in it, multiple levels or molecule size of hyaluronic peptides. It's amazing, okay? So, and I also have a little bit of the Exotran exosomes in it, okay? This, by the way, I'm going to be using this on another video where I'm going to be showing you how I do my scalp treatment, okay? So what I'm going to go ahead and do is I'm going to do the one that's corded first. I've already done this a little bit, but I kind of want you to see. The exosomes does have a little bit of an amber tint to it because that is the amount, the high quality and the high amount of the PDRN in it, okay? So it's going to look a little bit amber, but it is going to be a little bit diluted because I mixed it with another ampule, okay? So I actually have the 12 pin needle in this one, and this, just so we can kind of compare, I'm going to actually put this on 1.5, okay? And we're going to kind of compare the two because I'm going to do it on the side of my face. Okay, so this has 5 levels to it. You're going to turn it on by here, so you're not going to be able to get the corded one anymore, but I just wanted to show you how I do this if you still have this model, okay? This is the lower setting. If you're wanting to see pinpoint bleeding, sorry, I'll spell it out here in a minute, pinpoint bleeding, my lips are a little numb, you're going to do it on a lower setting, okay? If you're doing it on a client or on yourself and you're like, it's not getting red, you want to see severe redness, you're wanting to see the pinpoint, just keep it at a lower level because the needles are going in slower, okay? So I'm going to do, I'm actually going to kick it up to one of the higher levels, okay? That's the highest level. I'm going to put a little bit more ampule on here because I've been chatting. So what I do is I do the ampule first, then I do the needle. This is 1.5. Okay. Again, that's with the corded one. Okay. Now, I'm going to do the 42 pin with the new model. That's not corded, it's chargeable. And I'm going to have it at the same depth, which is 1.5. I really like this device a lot. So it's worth the upgrade. It's worth getting, definitely. How you turn it on, first off, before you turn it on and when it's charging, you're going to see L, meaning that it's low, F, when it's completely charged. Okay, so I love that. It also has a little LED thing here, so you know that there's a 1 right there. If you do it 2, this has 6 settings, okay? So if you're in the middle of the treatment or getting ready to do the treatment and you're trying to get your things in order and you don't really, like, is that on 5 or 6 or, you know, is that on the highest setting? You don't have to worry about it anymore because it actually has that number 6 on there, okay? So what I'm going to do is I'm going to put a little bit more ampule on this side. and hopefully not get it in my nose. Okay, and then I'm just going to do my crisscross. Okay, now I'm not worried about my redness because one, I get very reactive skin. Plus part of this is because I'm doing the exosomes as well. We include in the bundle, with the new one, you get 2 boxes of nano tips. You get a box of 20 round tips. You get a box of 20 on the square tips. You get a box of 20 of the 42 pin, which is what I'm using. And then you get the box of 20 on the 12 pin, okay? The difference between the 12 and the 42, I feel like the 42 is not as painful. The 12 pin is, okay? It's not painful, but you can feel it more on the 12 pin, okay? Then you also get some of the Pelia growth factors in the bundle, and you get some of the BioSalis soothing mask from Skin Culture also in the bundle, okay? So if you have the previous model and you're interested in upgrading, please reach out to me directly, okay? So we can have a chat, okay? So I'm just gonna kind of go over this again. I do the ampule, do needling, and then I do the ampule again, okay? A question that I get asked all the time is, if you have extra ampule, do you need to put in the refrigerator? Yes, you do. Just get in the habit of putting all your ampules in the refrigerator, so then you're not having to think about which needs to be refrigerated, which doesn't need to be, okay? Try to use them all within 7 days, especially the growth factor, especially the exosomes and the Pelia growth factors, okay? Those need to be used definitely within a week. I just try to use all of them within a week. The other thing is that people will ask, well, what do you do with the extra? Can I give it to my client? I do that all the time because that is a great aftercare to send them home. If you want to include that in the bundle, in the price, then do that. If you want to gift it, it's your business, whatever you feel like that you want to do. But I will send that home with the extra all the time, because I say, use this the rest of the night. I'll give them a soothing mask to take home with them, and say after the numbness wears off, you're probably going to feel like you have a mild sunburn and your skin's going to be tight. There's not going to be any sloughing off of skin, but if they feel like that they want to do that soothing mask after the numbness wears off that night or maybe the next day, that's perfectly fine too, okay? So those are some kind of little tips that I wanted to share with you. My main thing was I wanted to introduce you to the new pen and compare it with this. This is a fantastic pen, but don't be bummed if you have this and you're happy with that. If you want to upgrade, then again, reach out to me, okay? Have a blessed day, and let me know if I can help you in any way. My direct line is 719-654-3623. Or you can email me at brenda.aomedusa@gmail.com. Have a great night.